Have you ever wondered what it would be like if you had a mental disorder while you were a child? Do you ever wonder what your life would be like now? ADHD, or Attention Deficit Hyperactivity Disorder, is a chronic condition that many children get diagnosed with every day. It includes hyperactivity, attention difficulty, and impulsiveness. Some of the points that I will be discussing today are the causes, signs and symptoms, and the treatments for ADHD. ADHD has many different causes. Many of them show up while the person is still a child. A lower level of activity is associated with ADHD in the parts of the brain that control the attention and activity of a person. There is a 1 in 4 risk that a child with ADHD may also have a parent who has ADHD, and some of those parents are often diagnosed while the child is diagnosed. ADHD can also be increased by a severe head injury when the person is a child. ADHD can also be increased when the child is born prematurely. Prenatal use of alcohol and smoking nicotine can also increase the level of ADHD in a child. Depending on the person, they can also have different signs and symptoms. Many of the signs and symptoms that I will be listing also depends on the person's age. Many people have behavioral, cognitive, and mood symptoms such as hyperactivity, lack of restraint, mood swings, and anxiety. Children ages preschool to grade 2 often have difficulty following directions and often are told to stop and listen. Children ages 3 to 7 seem to daydream and lose focus on what they're doing, while others also feel restless. Many teens have trouble staying organized and meeting deadlines, while others act impulsively. There are many different treatments for ADHD. 2 of the treatments I will be discussing are therapy and medication. Therapy may mean that the child and the parent or parents was to go into what they call behavior therapy to learn and reinforce different things to remove the bad behavior and or problems. They also learn how to reinforce happy and healthy habits in a child's life. Another medication is stimulants, which about 70 to 80% of children are taking now. And they also have less ADHD symptoms while taking them. The other medication is non-stimulants, which not many children take, but they don't work as fast as stimulants do, but they also last longer, up to 24 hours when taken. In conclusion, I have discussed that many children are diagnosed with ADHD every day, and they have different causes, signs and symptoms, and treatments for it. 1 in 6 children ages 2 to 6 years old are diagnosed with a behavioral, mental, or developmental disorder. Many of these children are not being treated, but that does not mean we do not have hope for the future. We need to make sure we know the signs and symptoms so that we can get teens and children treated and have the medication and help that they need. Thank you.